interpersonal communication theory and practice in healthcare. What is interpersonal communication? Interpersonal communication is the process by which people exchange information through verbal and non-verbal message. Paraverbal form is the origin of interpersonal communication. Both of the form and the content of the communication reflect the person, characteristic of individual, as well their social roles and relationship. Next, what is healthcare? Healthcare is not the things to be given, both or source at all, but an entire ecosystem with many specific moving components. Healthcare refers to organized provision to individuals and communities of medical care. Health profession is not only doctor and nurse. It in helping people live well, administrator, therapist, psychiatrist, paramedics, and technology profession all have a position. So, what is interpersonal communication theory and practice in healthcare? In healthcare context, the study of communication has a focus that goes beyond other fields of inquiries. Communication in healthcare settings are often seen as so important and so relevant to daily situation. And communication process is important to elevate life quality or absence of life.
Today I will present about who is people that involved in interpersonal communication theory and practices in healthcare, or can be called a founder. One of the founder is Corey Floyd. His education background starts when he get degree in arts of Western Washington University in 1991 and get his master of arts in major of interpersonal communication in 1994. Then Corey Floyd continues to get his PhD in University of Arizona, major in interpersonal communication, minor in family studies, and continue to get Doctor of Psychology coursework at Fielding Graduate University School of Psychology. So during his lifetime, Corey Floyd has written 16 books and over 100 scientific papers in communication field. As a professor that contribute to communication field, Corey Floyd has got a lot of awards such as Charles Wilbert Award and Bernard J. Brummel Award from National Communication Association. So his work shows people that communication lead to good mental health and physical health. In his research of affection, he found out that affectionate people can sleep better, have strong immune systems, involvement less misery, and recover more rapidly from stress. In his current considers, he is investigating whether affection is a successful way to recover pain. So, beside Corey Floyd, one of communication scholars that contribute to interpersonal communication in healthcare is Owen Hargy. Owen Hargy is emeritus professor in the School of Communication and Media at Ulster University, Northern Ireland. During his lifetime, he has published 27 books about interpersonal, health communication, organizational communication, crisis and cross-cultural communication that led him to get awarded a Senior Distinguished Research Fellowship by Ulster University. So focusing on interpersonal communication in healthcare, he published a book which is Handbook of Communication Skills and Communication Skills Training for Health Professionals that broadly utilized by most health professions in the world. So one fun fact about him, while writing a book, he loved to listening to 1960 music.
The study of communication in healthcare setting are viewed as so significant and so relevant to daily life. Research on communication in healthcare has developed in the last 20 years that was the most rapidly growing and interesting topic. Interpersonal communication in health developed with two connections between these two elements. Number one, low patient participation, poor comprehension of treatment recommendation to poor adherence and decreased survival or poor quality of life. Number 2, provider apathic behavior, patient certification, less decisional regret, and continue relationship of few malpractice suit. According to Gelly, in the last 40 years since the early work, in that those communication behaviors consistently relate to parental and patient certification and increase doctor-patient collaboration. Uncertainty management within the interpersonal communication in health domain has grown considerable over the past decade. For example, cultural variation in response to uncertainty may be a fruitful expansion. This could help promote more effective interaction in which patient and healthcare provider are from different cultures and use different languages. In developing the interpersonal communication in healthcare, contact of relationship between the health worker and the patient, compliance with professional ethics is required. As Professor Muskie, which is follow out as it follow. Number 1, honor your patient regardless of age. Number 2, offer the same gratitude and attention to the poor as to the rich. Number 3, respect your noble mission, beginning with your very own person. Number 4, let your fatigue enlightened by faith and love. Number 5, never humiliate the sick who is so humiliated by their sick illness. Number 6, never forget the secret entrusted to you about a disease is something holy that cannot be betrayed, offered to another person. Number 7, do not see in your patient worries as burden. Number 8, never show incongruous at the success of the treatment on a sick person. Number 9, do not benevolent but only science is required in the care of the sick. And number 10, do not discuss medical prescription with the patient and never contradict them. You take away their confidence in medicine. You destroy their hope of healing.
Today, I want to talk about role of interpersonal communication and practice in healthcare. Interpersonal communication in healthcare is an ability of the doctor to produce an understanding the patient concern, to explain healthcare issues, and to engross in shared decision making if desired. It's not only what you're saying, but more than that, it's also how you say it and how or what you mean by what you say. Next, I want to talk about benefits of interpersonal communication and healthcare. The benefit to patient, they can get accurate diagnosis and appropriate treatment. Other than that, they can adhere to their treatment and they can utilize to follow up their service, also maintain their health. For the doctors, they can improve quality of service, they can reduce the cost of treatment, and they can reduce workload and save time. For the health system, it can increase efficiency, greater cost effectiveness, and healthier population increase. Next, I want to talk about the goals of interpersonal communication in healthcare. The first goal is counseling. The target is to make the patient understand their illness and understand their treatment. The second goal is problem solving. Problem solving means the doctor and the patient need to tell all information to give them the best diagnosis and suitable treatment according to their illness. The third goal is caring. Caring here means give them stability and to maintain a positive vibe with the patient. Next, I want to talk about verbal communication techniques and non-verbal communication techniques in healthcare. There are three types of question the doctor can ask to the patient, which is open-ended question, closed-ended question, and probing question. Next, the doctor need to listen what a patient talk to them, and then they need to give reflection for what the patient give information to the doctors, and then they need to make conclusion for the information that given by the patient, and then they need to give motivation to their patient. Last but not least, they need to give simple and compact information to their patient.
In conclusion, everyone should be well informed and concerned about the quality of care. Providing an effective healthcare system is always a challenge for all countries in the world. Everyone should be well informed and concerned about the quality of care. These are messages to the audience that quality of care can be measured and improved, and quality of care should not be overlooked in the pursuit of cost control. Reinforcing these messages means that ensuring quality is on the health care delivery agenda, with a clear identification of the risks and opportunities posed by healthcare changes in the world. This means that health plans, healthcare organizations, and physicians must be responsible to patients and society, and conversely, how individuals can take appropriate responsibility for their own health. The effectiveness of the communication depends on what kind of relationship is established between the two partners and the type of relationship each person has. Doctors determine their personality traits, giving the patient the freedom to choose their own path to a relationship with the patient. In the health system, communication can quickly become a therapeutic strategy, which is a diagnostic skill that builds relationships and benefits those involved. Acquiring more communication skills should be a priority for healthcare professionals. Thank you.